SPIRE is an interface, it's an electronic interface that allows us to get information from the hospital directly into electronic medical record. So we're getting dictated reports, so those would be hospital discharge summaries or clinic notes that a patient, one of mine would have went to. We're also getting digital imaging reports, so any imaging that was done, like MRIs, CT scans, we used to get those by paper, but now we actually get them electronically, as well as some of the outpatient blood work. So if a patient of mine went to a urologist and they got their PSA done, well, that information would come to me paper-based format before, and now with SPIRE electronically in text-based format. One of the most important things it's done is it allowed me to have timely information, so it's there when I actually need it, and it's legible. So sometimes when we get reports back from other individuals, they're not as legible, and it has to be scanned in, and then you lose again another layer of legibility or clarity, let's say. For patients, it's great because a lot of the information that I review with a patient, I review directly with them. So in a patient's room, I'd swivel the monitor over and we'd review the information together. And they can see that the report is there, it's easy to read, and they can see how I'm actually using it with some of the alerts. And I think that's probably increases their confidence in our healthcare system as well. And I know one of my colleagues has saved time for, in a week, she can reduce the scanning from 144 minutes down to 22 minutes. And that saved a substantial amount of time where other patient care activities can take place. So you can bring more patients in for their care. Well, I can be very hopeful that the evolution of SPIRE continues, because there's still a lot to be done, such as I understand, the future of SPIRE, one of the elements will be discharge summaries for medication lists that a patient's been on. These are vital to our practice, especially timely getting the information that we need to. Since we have patients that are discharged from hospital, that I can see the report following them, because that's happening nowadays through the original SPIRE interface. But I can see in the future it'd be nice, because if we can get the medications in, then we can reconcile them with what we actually have in our own electronic chart and make sure for patients' safety and their optimal care that we know exactly what doses they're on, exactly what they went in hospital with and came out. I certainly know now that the system works. It certainly helps our patients, helps our doctors, and helps our system.